So good afternoon and welcome to the 2024 Progress Report on the status of Arizona's bioscience sector. I'm Tammy McLeod, the President and CEO of the Flinn Foundation, and it's my honor to welcome all of you here today. This is my 7th time opening this annual event, and I can tell you that each time the evidence is growing that Arizona is making a deeper impact on the national and global bioscience stage. From Flagstaff to Tucson, Yuma to Metro Phoenix, the biosciences are helping to strengthen and diversify our economy while providing Arizonans with access to the latest health innovations. For those of you not familiar with the Flinn Foundation, we are a privately endowed philanthropic grant-making organization that was established in 1965 by Dr. Robert and Irene Flinn. The foundation's mission is to improve the quality of life in Arizona to benefit future generations. And we do that by supporting the biosciences, arts and culture, civic leadership, and a college scholarship program, all for the benefit of Arizona. Back in 2002, we worked with community leaders and Patel to develop a long-term strategic plan to advance our bioscience sector, and that's known as Arizona's Bioscience Roadmap. Over the years, this roadmap has provided a North Star for our statewide bioscience sector. It's also sparked countless collaborations across institutions and sectors. Today, the roadmap is the longest-running statewide bioscience strategic plan in the nation. So one of the tenets of the roadmap is to consistently measure the performance of the state's bioscience sector and to report those results back to all of you and the community. We've been tracking the same set of metrics since 2003, and we use what we learn to help chart our collective next steps. During the first decade of the roadmap, we tracked those metrics annually, and since then, we've tracked them every other year during even-numbered years. That's what we're here to present to you today. In today's presentation, we'll be joined by Mitch Horowitz and Ryan Helwig of TEConomy Partners. They'll share the latest metrics to contextualize the key areas of impact. And then following their presentation, we'll learn about a rapidly developing area at the intersection of technology and life sciences, digital healthcare, wear tech, and medtech. We're grateful to have a panel of experts with us to provide insights on why this area is growing so fast and growing so fast locally. Every year, in addition to this event, the Flinn Foundation compiles a brochure covering the highlights of Arizona's bioscience sector over the previous year. It also offers a perspective on where we stand and what comes next. This newest report covering 2023 is now available on our website at the link that's available in the chat box. On the website, you can find the entire catalog of our annual bioscience progress reports dating back to the launch of the roadmap. And I encourage you to read the new report and to share it with your teams. As many of you know, the current iteration of the roadmap extends through 2025. And I'm very happy to report to you that the Flinn Foundation Board of Directors is currently considering what the next iteration of the roadmap will look like. In this process, we're going to need your help. You'll be hearing from us because we need the input of the bioscience community as an essential step in planning those next iteration. You may hear from us with requests for surveys, interviews, focus groups, and the like to help us put together that next iteration so that it's meaningful progress for our state. The engine behind the Bioscience Roadmap is the Bioscience Roadmap Steering Committee, which convenes over 125 of the state's leading research scientists, community executives, academic administrators, government leaders, investors, workforce developers, elected officials, and more. As with the best collaborations, we are strengthened by those who graciously give their time to work towards the goal of the roadmap. So thank you to all of the steering committee members for your efforts and your contributing roles, including our committee leadership, who you see on the screen. The steering committee features progress teams, and those project teams pair volunteers from the bioscience community with projects that can help to implement the roadmap. We currently have project teams that are focused on risk capital, entrepreneurship, and legislative relations. They have resulted in the annual Arizona Biopreneur Conference, Bioscience Programming at Venture Cafe, closer ties with policymakers, and much more. Thank you to all of the project team members for their service and to the team leads who are pictured on the screen right now. I'll now hand this program over to one of these leaders, Dr. Heather Carter, the chair of the Arizona Bioscience Roadmap Steering Committee. Heather started her chair position in January, though she's been active on the committee for more than 10 years, vice chair for the past 3 years, and legislative relations team member since its inception. She brings a depth of experience to this team from her background as an educator, as a business leader, and a state legislature. So today, Heather serves as the Senior Vice Chancellor of Maricopa Community Colleges. Heather, it's yours.
Thank you, Tammy. I really appreciate that introduction. And, as you've said, I've changed my professional hat a few times over the past decade. The one constant has been my commitment to Arizona's bioscience roadmap. I'm a true believer in what the biosciences has done for the state and really what the roadmap has done for the biosciences. So through the 5 goals you see here on the screen, Arizona's bioscience roadmap has been a strategic plan used by many to grow and diversify Arizona's economy and to enhance the health outcomes. So you, the residents and community members of Arizona, are why we're here today, to assure that the best possible information is available to continue making these strides. And as Tammy said, please do check out the brochure that the Flinn Foundation has compiled on the progress of the biosciences over the past years. I'd like to underscore a major theme of that report, and that's Arizona's progress on medical education. I've been involved in medical education through various roles over my career, and it abhors me when I see statistics like Arizona needing 2,000 more primary care physicians and 23,000 more medical professionals in general to serve its population. We must do better. And as you know, the Arizona Board of Regents has proposed the AZ Healthy Tomorrow initiative. And when funded and implemented, we'll expect to see a new medical school at ASU with a focus on applying the university's standout capacity in engineering to benefit patients, a new medical school at NAU, and it's meant to boost the supply of primary care practitioners in rural, underserved, and indigenous communities, and a doubling of the number of medical students at UA's 2 medical schools. So major increases in the number of nursing and allied health graduates. And that's just the tip of the iceberg. Much more along these lines is available in the brochure, so make sure you check it out. But a successful bioscience ecosystem relies on input by elected officials, and we are honored to be joined today by a number of them. Their names appear now on the screen, and I'd like to thank them for taking time from their demanding schedules to attend today's events. And also, we're pleased to have David Gullett and Heidi Jeniga with us today from the Flinn Foundation's Board of Directors. We're also privileged to have 4 of the past 5 steering committee chairs in attendance today: Marty Schultz, Ron Schupman, Mark Slater, and Eve Ross. Their personal commitment to the biosciences has been extraordinary, and I am honored to continue the tradition that they have set. So now I'd like to introduce Mitch Horowitz and Ryan Helwig to join us from TEConomy Partners. And TEConomy is a spinoff of Patel, formed in 2015, and many of the TEConomy team members have worked on the Arizona roadmap since its early days, including Mitch and Ryan. Mitch is a co-founder and senior fellow. Ryan is principal and project director. Both are experts in technology-based economic developments. And you can find their bio sketches via the link posted in the chat box. And if you have questions during their presentations, please just enter them in the chat. And then I'm going to return to pose those questions to Mitch and Ryan following their presentation. So please join me in welcoming Mitch and Ryan. Thank you, guys, and take it away.
Well, thank you so much, Heather and Tammy, the entire Flinn Foundation team and the steering committee of the roadmap. It's wonderful to be with everybody again. I'm just setting up the slides here. And Mitch, does that look okay?
Yes.
Okay, great. Well, we're excited to be with everybody to share updates on the recent 2-year performance of Arizona and Biosciences development. So thanks for the great introduction and context setting. I'll do just a little bit of that here as well. But as mentioned, our team had the opportunity and the privilege to assist in developing the original roadmap as part of Patel now more than 2 decades ago. We've tracked its progress, and as a group, I think we are in a particularly special position to appreciate just how far Arizona has come as a state in the biosciences. We know progress in the biosciences takes a combined effort and a shared focus, a real commitment and willingness to invest strategically. And importantly, it takes time and it takes patience. And so I think Mitch and I would really echo just how proud we are to see the state and its real commitment and focus on this over such a long period. So real testament to the industry, research and ecosystem leaders and stakeholders throughout the state. So the Biosciences Roadmap, as was just mentioned, was commissioned originally by the Flinn Foundation. It's tracked by our group on a biennial basis. And really, serving these unique sort of dual value proposition of the biosciences, going after this targeted industry, both for its economic strength and diversifying the state economy, as well as this sort of health dividend that the industry can pay with respect to access to health innovations for Arizonans across the state. Certainly, from the outset, the focus has been to leverage our unique research strengths and build a critical mass of industry, but also continue to keep an eye on the biosciences ecosystem. So over time, the roadmap has certainly matured and it's evolved. As it entered its 2nd decade, it really deepened and sharpened its focus on where and how Arizona can excel and how it will compete. Identifying specific areas mentioned here on this slide around precision medicine, cancer, neurosciences, bioengineering, diagnostics, and agricultural biotech, all areas in which we've seen those strengths both emerging and well established in this nice portfolio of biosciences niches for Arizona. And it's also focused on key development resources and that innovation ecosystem needed to be competitive. So in addition to touching on the industry progress and strengths, we'll be touching on how we're measuring that innovation ecosystem. So just to give you all a little bit of a preview and summary of the performance review, I think we're very excited to report the performance review finds continued and significant progress for Arizona across most of the major metrics we've been tracking. Again, a testament to the really focused and combined efforts across the state. In this update, we're now getting a more complete view of the industry's position and performance through the COVID-19 pandemic and the early recovery years of that, as well as key measures related to that innovation ecosystem mentioned. So just to hit a few highlights, and Mitch and I will begin to unpack this, you'll see an acceleration in what we call the non-hospital biosciences sector, the sort of industrial biosciences, with rapid growth through the pandemic and its recovery. We'll walk that out on a regional level as well. Seeing some challenges in terms of growth in the hospitals sector, which we'll touch on. Seeing strong growth, significant growth in wages. And as Mitch and I have been doing more intensive and focused work in Phoenix in particular, we know that there's some cost pressures that people are conveying to us, both in terms of doing business and living. Mitch will be touching on aspects of the innovation ecosystem where we've seen some real positives in NIH funding and its growth relative to the country, and an area where nationally we've been seeing a more challenging environment in venture capital funding to bioscience companies, but Arizona has shown resilience in that metric with some growth in 2023 we'll highlight. One area where we've had a bit of mixed results is in university technology transfer, but we'll walk you through that and where we're seeing sort of a reversion to our averages that we've seen over time in certain metrics. But one thing we can say is that the biosciences remain a very important and outsized driver of university technology commercialization overall. So lots of positives to report here. And as we wrap up today, we'll kind of return to a summary performance review. In the first section of this review, I'll walk us through an update on the industry's position and recent performance, primarily with respect to jobs and employment growth, but we'll also touch on industry wages. We have some new analysis around industry job postings that gives some interesting insights on workforce and talent demands. We're going to touch on productivity and the regional updates I mentioned, but really quickly, just want to level set with everyone, remind everyone of the biosciences definition. We look at this as a very broad and diverse industry base with 6 major subsectors of the biosciences that you see here on the screen. This definition, in terms of these first 5 and what we typically refer to as the non-hospitals or industrial biosciences components, is very much in line with how we track the industry nationally with our partners at Bio. And in Arizona, we take a special look at the hospitals and healthcare ecosystem as an important research driver, medical education driver, driving clinical research and innovations, and certainly other aspects where we're deploying medical technologies. So let's jump into the jobs picture. Overall, Arizona employs more than 138,000 in the biosciences. That's 5.1% of our overall private sector jobs base in the state. Under this concept that I just mentioned, hospitals really dominate employment, representing about 7 out of 10 industry jobs. But the 39,000 non-hospital biosciences or industrial biosciences represent highly important and innovative pieces of the industry. And we've got a diverse jobs base there, almost 10,000 jobs in medical devices, and we exceed 10,000 jobs in both the bio-related distribution and research testing and medical labs subsectors. And as we'll see in a moment, the rapid growth we're seeing in this non-hospital bio piece has really increased its share of the pie here that you see on the left side. So very dynamic industry base. As we've presented in our biennial updates, Arizona's industry employment growth in the biosciences has been really impressive, both steady and continuous over 20 years. There's very few states that Mitch and I work in where you would see this type of almost linear growth. And it's generally well outpaced the nation. Since 2020, which is sort of the focus of our update here, which marked the depths of the pandemic shutdowns, in total biosciences, which is inclusive of hospitals, we've just outpaced the US, growing 3.8% versus 3.6%. 5 of those 6 industry subsectors we showed you have grown over this latest 2-year period. And just to quickly highlight progress over time, over the 2-decade period you see before you, Arizona's average annual growth rate has been 3.2%, well above that for the US at 1.4%. So in a national high growth industry, Arizona really stands out for this high growth over time. This slide takes a look just at Arizona and how we stand up against our overall private sector, which is the lower line on this line chart. Again, what's striking here is the real acceleration we're seeing in the non-hospital biosciences since 2017. And over the last 5 years, Arizona has seen an average annual growth rate in this segment of 8.8%, versus 2.7% for the overall private sector. And just since 2020, our non-hospital bioscience sector is up nearly 15%. So during 2020, you can see the dip in total private sector jobs, which have since recovered, but the biosciences really continue to bolster the state economy during that challenging year, and really, again, demonstrates this strong dual value proposition of both innovative medical and other technologies, along with the ability to support our state and regional economy during challenging times. So we'll want to unpack this growth just a little bit. This slide allows you to see the net job growth for the industry since 2020. You can see the top line measures we just sort of walked through on the left side, but also it offers a chance to quickly unpack on the right side the job concentrations and growth that are driving these top line trends. So on the right side, this bubble chart plots employment change on the horizontal axis. So everything to the right of that vertical bar, all 5 bubbles that we're showing have grown since 2020, some quite rapidly in pharmaceuticals and research testing and medical labs. On the vertical axis, we show location quotients. These are measures of the relative employment concentration in Arizona compared to national averages. So everything above that line is a 1.0 or greater, where we have outsized job concentrations above the national average. So for medical devices, we've reached this nice concentration of 1.16. We're 16% more concentrated in medical device employment as a state relative to the country. So along with these nice growth rates, we're seeing some elevation in those concentrations. Biodistribution is now at the national average. It's been emerging, and biopharma manufacturing and research testing growing quickly. We expect to see those rising up in terms of their LQs as well. One challenge we'll point out has been that hospital sector. This doesn't mean that there's not this imperative in healthcare workforce. There's a lot of churn that underlies this, but we haven't seen the net growth in hospitals over this 2-year period that we've seen in other segments of the biosciences. This new metric that we mentioned, we've been mining job postings to give folks an understanding, additional way to sort of gauge industry demand dynamics with a focus on underlying workforce and talent. We've mined the latest 2 years of unique or non-duplicative job postings in the non-hospital sector. So this look we'll give you today is the non-clinical component of the biosciences. Impressive totals. We're seeing 28,000 unique job postings in the last 2 years by Arizona employers. And though as a state, we lag a little bit behind the US average in our share of total postings, it reflects Arizona's diversified economy and our continued emergence in the biosciences as a state. There's a lot of underlying activity here in terms of who's hiring and the job postings, job titles that we're hiring for. So in terms of leading employers with new job postings, I think we would want to just point out the diversity in the bio industry represented here. As you look at who's hiring to both replace and backfill, as well as support new growth, you're seeing companies in biopharmaceutical manufacturing, you're seeing medical device manufacturers, diagnostics companies, clinical research organizations, and medical labs. The real breadth of the biosciences is illustrative in those employers. And on the right side, you see the breadth of in-demand job categories spanning middle skills occupations or those that typically demand less than a bachelor's degree for entry, such as medical technicians, lab techs, production roles, material handling, as well as the high skills expertise that you see in an innovative, science-driven biosciences ecosystem like medical scientists, engineers, management roles, et cetera. So just a window into the hiring that's underway. In terms of wages, wages we would say reflect a number of dynamics in the ecosystem: the industrial composition, our makeup of the biosciences, the value-added activities of those segments, cost of living, cost of doing business, worker productivity, and the types of roles we're trying to fill. So on the left side, we see average bioscience wages are paid at a premium relative to our private sector. They're 20,000 to 35,000 greater than those for the total private sector in Arizona. This is a significant wage premium for the biosciences. It, again, reflects that value-added context, the skills demand, though it's still below national averages in terms of wages. On the right side, we show that for Arizona biosciences, wages are rapidly rising. They're rising a bit faster than national averages. And these can point to some different dynamics that we may have in Arizona relative to the country. And again, in some of the work we've been doing in the Phoenix market recently, Mitch and I have been hearing a lot about sort of cost of living dynamics, the challenges for affordable housing and sort of broader inflationary context. And we know that that's one component driving wage increases. And perhaps we can discuss that a little bit with you all in the Q&A portion. We've also begun to focus a little bit more on productivity, and as roadmap efforts really progress into this third decade, I think it'll be important to consider and continue to monitor value-added context of our state industry and how we continue to level up as a biosciences ecosystem in terms of our innovation, our production activities, research, et cetera. These data reflect industry productivity relative to the country as calculated by gross regional product per worker. We see on the left side, Arizona is behind the US in these levels for both of the bioscience industry totals, total and non-hospital. And on the right, that we see that while growing, the state is not growing as fast in productivity as the rest of the country. So we have this situation where, again, I think we'll want to track this going forward. We're outpacing the nation in wage growth, but we are lagging a bit behind in productivity growth. A balance we want to be careful doesn't get too far out of alignment, where we end up with higher and higher wages that are not reflective of corresponding productivity gains. So again, something for us to all track as we go forward. Turning to the regions of the state, I think it's really exciting as we look over the long term here to track gains realized throughout the state. As Tammy mentioned in the introduction, this is an industry that plays out throughout and across our state. As we see here, long-term job growth in the biosciences is acting as a major driver of the metro economies across Arizona, really outpacing our private sectors in Flagstaff, the greater Phoenix region, and greater Tucson. And long-term employment gains have really translated into regional specializations, real niches and strengths where regional location quotients, again, those measures of relative concentration, show we have a number of not only above average concentrations where we sit somewhere between 1 and 19% more concentrated than our national averages. These are the open circles that you see here. For the state and medical devices, where we're 16% more concentrated for Phoenix in distribution. And then we have what we designate as specialized concentrations, where you have a 20% or more greater concentration relative to the national average in employment in these segments. These are the closed circles where we see Flagstaff and Tucson have specialized concentrations in device manufacturing and hospitals. And so this steady continuous growth is really translating into a unique set of strengths across our bioeconomy. So I'll pivot now to Mitch and allow him to walk us through what we're seeing across the innovation ecosystem.
Great. Thank you so much, Ryan. Similar to all technology-based industry clusters, you need to have a strong innovation ecosystem to draw on to grow your businesses. So Ryan just walked us through kind of the overall industry efforts that have been happening. I'm going to kind of take a look at what's been happening across that kind of early part of the funnel here, and in terms of how do you actually grow an a cluster through your innovation ecosystem. And what's important to understand about this is if you have any missing links, then you are liable not to realize your full potential. And so, we care a lot about understanding how this all fits together, but we also understand that the biosciences cluster overall stands apart from other industries. First, there's a really close connection between basic research and new product development. So, you can't be an industry leader without continuing to innovate. You also have a very important translational research linkage where you have to go from bench to bedside, and those requirements around clinical testing and the need for clinical excellence to inform where you need innovation really is what stands out in a vibrant biosciences ecosystem. And then when you think about what it takes to succeed in the business side of the equation, whether it's around starting up and scaling up new ventures, whether it's around the specialized skills that Ryan just walked us through, or even the types of facilities you need, the biosciences stands out from other industries. So first, we're going to kind of take a dive into what's happening in the R&D. And so the first place we start is around how the universities are doing. And this is a data set that is collected through the National Science Foundation, and it looks at overall university expenditures in the life sciences and biosciences. And you can see that over the years, Arizona continues to make steady gains. And when you compare it to the country, it's pretty comparable. But it's also important to understand that the universities still have a long ways to go in growing their capacity. So in Arizona, overall biosciences R&D is 42% of total university expenditures, while nationally it's 61%. So as you hear about these new medical schools starting and the expansions at U of A, that's what is so important about those things, is to kind of make up continued room for growth in the biosciences relative to overall university expenditures. But the place that kind of stands out for Arizona on the next slide is what's been happening in NIH funding. And this is really the gold standard in biomedical research funding. And what you can see here is that Arizona, over this recent performance period, has really been making strong gains, 29% compared to just under 10% for the country. So that 3 times growth in Arizona, the result of it is that, the share of Arizona's comprises of national funding and NIH has never been higher. So we are really outpacing everything we've done in the roadmap for over these past 20 years. And that is, just something that is really outstanding in this year's biennial performance review. When we take a little bit deeper look into the NIH funding, what stands out is it is broad across not only the universities, but in the hospitals and nonprofit research institutes like TGen, and also within the companies. And you can see this composition is on par with the country. So as Arizona continues to make gains, it's maturing in a way that's very similar to the country. It has a lot of different drivers of NIH funding. Now, we recognize when we took a little bit of a deeper look here that 2 of these sectors really stand out. Both the universities and the hospitals and the non-profit research institutes have really had exceptional growth. And what this suggests is that we need to continue to have broad-based engagement and collaboration across Arizona. And that's kind of a hallmark of the overall roadmap, is that we all grow when we grow together. And as Ryan indicated, the next stage in developing the ecosystem is how well do we do in taking that R&D base and finding ways to move it into the marketplace. University technology transfer makes up the biggest, universities make up the biggest portion of the expenditures. And so we take a deep dive into what they've been doing around technology transfer. And the news here, as Ryan indicated, is a little bit more mixed. On a positive side, patents are up, licenses and options executed are up, and royalties are up. And that's all very, very positive, and it suggests that the technologies that are in place are leading to real innovations that are then making their way into the marketplace. But what catches the eye here, and we understand its importance, and so we've kind of dug down a little deeper, is that yes, inventions are kind of on par, but what really has declined is that those bioscience startups. And so, to put it into perspective, though, we recognize that it's not so much that Arizona universities aren't performing well, it's just that they've kind of come back to their mean. And in fact, it's that 2020-21 biennium that we just came through, where they had exceptional formation of businesses in the biosciences. And in part, our sense is that that kind of reflects where the country was in venture capital. So there was a real premium being put on getting bioscience companies started up because the national markets for that were very strong in terms of venture capital. Now what we're seeing is a little bit more of a reversion to the mean, but also a focus more on getting licensing out there as a way to address the fact of how do you move things into the marketplace when the opportunities in venture formation are a little bit lower. And so then the next key metric that we look at in the report card is around that venture capital. And so what we see here is that in some ways, Arizona is kind of bucking the trends that we're finding nationally. You know, just to put it in perspective, we put these at different scales, but you could see if you follow the kind of more blocks here, then the country's really declined pretty rapidly, both in venture capital investment as well as in venture capital deals. But at the same time, Arizona's kind of held its own. So, you know, while we're starting at a smaller base in Arizona, we haven't been losing the kind of foundation that's been laid here. And that's particularly shown through the deal flow, right? So we've basically stayed at a pretty constant level between 53 and 60 venture capital deals each year. And in terms of dollars, actually, Arizona took a kind of bump up from 2022, which was a steep decline nationally, didn't continue to decline like it did in the country, and it kind of boosted up. And so we took a deeper look at that as well. And what we found as we kind of understand that venture capital investment in terms of the types of stages of deals is that actually there's something that is kind of breaking the mold for the first time, and we'll get into that. What overall stands out is a pretty consistent message about Arizona, which is we're much more concentrated in the early stages of pre-seed and seed investments. And so on the deal front, Arizona's has about 55% of its bioscience deals in that very, very early pre-seed to seed, compared to 47% for the country. When you look at it from an investment side, it's easy to see off the graphic. It's hard to see the dollar amounts for the pre-seed and angel, but what you do see is up through the seed, you have almost 15%, where nationally it's only about 7%. But the thing that stands out that's so different in this year's report card is that later stage deals really stand out. So both in terms of total number of deals, 33% for Arizona compared to just 30%, 29.5% for the country. But even in dollars, Arizona is much more comparable to the country relative to the share in these later stage deals. And so, you know, this suggests some key companies that have been successful, companies like GT Medical Technologies, eVisit, Connection Health Solutions, which have all gotten very, very substantial later rounds of venture capital. And that is so important in growing your overall ecosystem. The place where Arizona continues to need to work, and it's something that in many ways, a lot of the maturing of the ecosystem has been kind of all the conditions are ripe for in the years ahead, is getting much more Series A and B funding in place. What PitchBook calls their early stage formal venture capital. So that's something, again, along with what Ryan was pointing out in terms of productivity, that we need to be aware of and to keep working towards. And then we take yet another deeper look at venture capital because it helps inform kind of where the innovation is moving into the marketplace, where, you know, what distinguishes Arizona from other parts of the country, because it's not completely identical in your strengths. And as Ryan indicated, we've been doing a lot of work, taking a deep dive in the Phoenix region. And what we're learning here is that, you know, Arizona continues to stand out in having much higher medical devices, much higher IT, digital health, a bit higher in the healthcare services, but it's not like traditional biosciences clusters in other parts of the country, because biopharmaceutical is not as strong. And again, that's an area that over time will ripen as that basic research continues to grow. So finally, what we want to begin to kind of put forward is kind of the summary report card. And as you can see here by how many upward green arrows there are, it really does show, as Ryan indicated, that for Arizona, there's just continued significant progress across almost every metric here. And most importantly for us is that we can now see, having all the data in from the COVID, the onset of the pandemic, all the way through kind of the recovery from the pandemic, that, you know, in terms of the industry base, Arizona continues to fare really well compared to the rest of that country. And I don't know if it struck you all, but every time I look at that graphic that Ryan showed, it's like a launching of a rocket ship in terms of how the industry base in industrial biosciences is doing. But I think what this report card is showing is that both NIH funding and venture capital funding has also stood out, and where, you know, we need to continue to make sure there aren't any barriers, or thinking through how we can actually support further university technology transfer, commercialization into startups. Many other states do a lot around proof of concept funding and other things to kind of position their technologies so that they can become startups and grow. And maybe that's something that Arizona is going to need to think about as well. So we look forward to your questions here. There's a lot of, you know, intelligence that we've and numbers here that we've put out. So we know it may take some time to digest, but we're very eager to have a discussion with all of you now.
Thank you to the team. It's just impressive data. And I have to tell you, having been a part of the Bioscience Roadmap Steering Committee for, like Tammy said, over a decade, the stats don't lie, and it looks like we're doing incredible. And there's lots of green arrows on that box. So something to be celebrated. And I really appreciated that point about level setting post-pandemic and really what that looks like in terms of the data. So if anybody has any questions, please feel free to put them in the chat box, and I will wait for those to start to pop up, and I will track them. But I'd like to just kind of kick it off on some key points that you mentioned. Let's dive a little bit more into hospitals. So what trends are affecting hospitals locally and nationally that resulted in very little employment growth? Can you speak to that?
You want to go?
Yeah, go ahead, Mitch.
Yeah, so I think you know hospital systems all had to deal with COVID, and it was a very difficult period for a lot of the hospitals. So you know the hospital don't stand out necessarily compared to the country. It's difficult across the country, and in lots of our different engagements, you start to see it. At the same time, you see that in terms of hospitals with the shift towards accountable care, that always has an impact on the way that hospitals are really trying to maximize efficiencies in employment. And but I could tell you from looking at the latest progress update that Flinn put together, you could just see what's coming. So I don't think there's any lack of sense from the hospital systems in terms of their expansions that are taking place. So whether it's Banner or there's a whole bunch of hospitals listed here in terms of Honor Health and some of the rural hospitals in terms of Copper Queen Community Hospital. You really see a lot of developments that are kind of pent up demand that may in fact continue to grow the hospital employment. But Ryan may have some other insights as well.
Yeah, I would just add that we know the churn is there. We know hospitals and health systems are having real challenges employing and identifying new hires in nursing and allied health and physician workforce. Some of our recent work, again, in Greater Phoenix, has pointed out the need for clinical research professionals, clinical research associates, folks to, be on point leading clinical trials work. So there's no doubt to us that it's a real challenge, but just, an interesting time to sort of see it flat out, flatten out in terms of its growth profile. But these are real challenges that hospitals across the country are facing in terms of the workforce and what's coming. And we know with the growth in population and overall growth in Arizona, this is going to be a real challenge ahead. So the Healthy Tomorrow initiative is very appropriate. Heather, you're on mute.
Yeah. I wonder if we can unmute.
I had to get permission to unmute. I was like, trying. Thanks, you guys. So, kind of keeping in related to like jobs and really like the salary related to the biosciences. So, like, what factors do you think will lead to our bioscience and non-hospital then bioscience jobs being paid comparably to the United States averages? Is it something unique to Arizona or the Phoenix market, or what are your thoughts around salary equity?
Well, I think in part it is differentiated by, as we mentioned, in part the industrial makeup of the biosciences. There are higher paying segments of the ecosystem where other parts of the country are more concentrated, like in the biopharmaceutical development and manufacturing segment of the industry, where wages are typically a bit higher. And as we've shown, you have a little bit less concentration there. But what's exciting is the growth that's happening throughout Arizona in that space. And so I think we would anticipate from a compositional perspective, some of those wages would rise as well. But as we mentioned a couple times, I think we have been hearing about some of the challenges to recruit in new talent in our work in Greater Phoenix, given some of the costs. And so I think that is putting upward pressure on wages. Some of the companies we've been talking with have real strong growth profiles, like in the molecular diagnostic space, and they're trying to attract in new talent. So oftentimes you see some of the wage growth in response to that. But Mitch, what would you add on the wage?
Yeah, and I think this is another part of a maturing kind of biosciences industry cluster. If you think about where we were back in the start of the roadmap in 2002, how far we've come, and even some of the recognition that you've gotten from EDA around manufacturing and medical devices, and what needs to happen here is that the product mix needs to get higher value added as well. And so that doesn't happen overnight, and I think that for the next decade it's seeing that real high value growth, not just growth, that will matter in Arizona, and the ability of the state to keep up with other competitors like Utah or Colorado, so sort of nearby states that are also in that same trajectory where they're having strong growth over time, but they have to always be mindful: are they having deeper, more innovation-led growth? And that I think is just a wonderful position to be in, to be able to think about how do you realize that potential.
So a follow-up to that then, do you feel like it is really a regional competition, or is it industry specific competition in terms of leveling our equity around salaries?
Yeah. So my own sensibility about this stuff is I don't think this is regional. I think this is national, international industry, global industry. And what you have to continue to focus on is, what can you be excellent at? And so that's something that, I think we get some insights, not just from the overall, broad industry growth, which is hard to see some of the unique areas of technology. I think the venture capital data really helps bring out, Arizona is not like everybody else in the life sciences, and that's good. What you want to do is you want to have distinctive areas of growth that really relate to um, um, the growth drivers, where your core research competencies are. And, Arizona has a lot going for it. And its growth, having worked in Colorado and having worked in Utah as well, it will be different. It's not going to look exactly the same as those states.
Thank you. That's interesting. I do see there is a hand raised. I was going to type that in the chat. So if you could type that in the chat, that would be great. I think that'd be easier, unless I don't think there's a way to manage to get one question in. It would be great. So looking at the chat right now, in terms of the university's tech transfer and spin out numbers, how does that compare nationwide?
Yeah, it's a good question. It's honestly a challenge to cull out just the biosciences from university tech transfer. We are able to do it here because the great partnership the Flinn Foundation has with our 3 research institutions. We're able to go to their tech transfer offices and ask specifically about the biosciences. But as we look at the volume of activity, the combined startups, I think to us it really stands out as high volume. We have universities that are thinking this way. We have an orientation towards commercialization and tech transfer in our universities that is strong. And so as you see these, 30-ish startups coming out each year, the high volume and invention disclosures, and the real outsized share that are bioscience specific, I'd say, Arizona stacks up pretty well. Mitch, anything to add there?
Yeah. No, so the one thing that, in going through this, we mentioned that, Arizona overall in biosciences, R&D is about 42% of your overall base. And that is actually equivalent about the disclosures. But then if you look at the measures of commercialization, things like patents issued and licenses, and certainly royalty income, and even the biosciences startups, much higher percentage in biosciences. So, I do think that the technology transfer operations, in Arizona are generally pretty strong. And they're doing an outsized level of activity in the biosciences. So that's always a good thing. Again, other states are very focused on this. We just got done working in North Carolina. NC Innovation put $500 million to supporting university commercialization statewide. So, wow. Right. So we already know, Mass Life Sciences Center. Again, it started, I think it was $1 billion. They just upped it another 700 million. We worked with them on helping to make the case for that based upon their past performance. So you have other states who, we would all look at and say, wow, those are like aspirant states. They're not slowing down, and they're aiding their university commercialization activities.
Wonderful. Okay, no pressure, Mitch and Ryan. If you're game, I'm game. We've got the questions are now coming through the chat, sort of rapid fire, and we've got about 6 minutes left to go. So can we rapid fire a few of these questions? Are you ready?
Try, yeah.
Okay, here we go. I'm going to flip flop. So what appears to be the major bottleneck or obstacle in the university tech transfer growth? And then I'll go back to Jim's question and work sequential. So what's the bottleneck?
I think ultimately it requires having a really strong entrepreneurial community to work alongside it, which, again, being a rather new state in it, it's hard to get those entrepreneurs around it, but it's also having proof of concept funding at a very significant level, and gap funding more generally in order to move the technologies forward. And
Okay.
and Arizona is no different than any other university system in that regard.
Okay. Which states have performed better than Arizona in the last four years? Utah, for example. Can you rapid fire that? Do you know?
It's hard to beat it's hard to beat Arizona on a percentage growth basis in terms of what we were showing on those early jobs charts. But there are leading states and large states like the couple Mitch mentioned there, North Carolina and Massachusetts, that continue to grow at rapid rates on even larger basis. So I think we love the emergence and the continued strong growth, and Arizona is well on its way. And certainly, you know, if it wasn't out before, the secret is out on Arizona in this space. But there are some large and leading states that continue to double down, invest, and grow strongly.
Okay. Well, we're running up against the end of the time. There's a couple of questions in the chat. I can. Do you want me to try a couple more? Or you?
Well, also, Heather, I mean, just so everyone knows,
To you?
keep sending the questions in, and Ryan and I will respond to them
Oh, that's wonderful.
offline. Yeah,
Yeah.
well, we're wonderful guys, so you know.
You're wonderful guys, and great data. I mean, really, we really appreciate to be able to work with you over a long period of time. Really allows you to have more of a qualitative lens on what's really happening, and just not looking at static numbers. And being a part of the Bioscience Steering Roadmap has given you an insight into the community and how it comes together to support the industry. So I really appreciate it, and lots of thank yous in the chat. So with that, I am going to keep us on time and pitch it over to our next segment. So some of you were online. We're online for when we had our last TEConomy recent presentation of a new study on the key growth opportunities areas of the bioscience core and greater Phoenix region. So in that report, TEConomy identified 3 areas poised to make giant gains. And those were precision oncology and medicine, translational neurosciences, and digital health, wearables, and medtech. So anyone familiar with the roadmap has heard about our prowess in the first 2 areas for years, but the 3rd area is relatively new and perhaps somewhat unknown to a statewide audience. So yet it's an area where we really have tremendous growth and opportunities in the year ahead. So thanks to the collaboration with the Greater Phoenix Economic Council, we're going to explore today what's driving growth in this area. And we're pleased to have my good friend, Wes Gullett, partner at Nexus Strategy Group. And he will lead, Anna, lead with the Partnership for Economic Innovation. So Wes, that's 2 hats you're wearing in this panel. And I'm going to hand it over to Wes to moderate the panel discussion. The panel will feature 3 local experts. Number 1, we have an entrepreneur, and her name is Ayushi. I'm going to make sure I get the name right. Ayushi Patel, co-founder and CEO of CenSys, a brain health screening company. A large company innovator, Alex Tessmer, who is Associate Director of Innovation at BD, a leading global medtech company. And an academician, Dr. Mark Van Dyke, Associate Dean of Research and Professor of Biomedical Engineering at the University of Arizona. So each has graciously volunteered to be with us today to share details and perspectives of their unique role in this sector. So Wes, I'm going to hand the reins over to you.
Thank you, Heather. Thanks for the nice introduction. And welcome to our panel discussion.
Wes, we lost your audio.
Am I back? Can you hear me now? All right, perfect. Thank you, Heather, for the great introduction. For the purposes, and welcome to our panel discussion. For the purposes of our discussion today, we're going to use the term medtech and to describe this area. So let me define medtech as it relates to what we're going to be discussing today. Medtech includes medical devices, wearables, sensor technology, implantable devices, the integration and analysis of data to provide better outcomes for patients, and enhancement to the process of patient care. So just about everything you can imagine is connected to medtech, and we'll have a rousing discussion about that. Now, I want to give you a little context around where we've been on our medtech journey. With Kathleen Lee from the Greater Phoenix Economic Council, the Partnership for Economic Innovation established the WareTech Applied Research Center in 2018. And we opened our center in Park Central in 2019. At the WareTech Center, we've assisted 22 projects with funding and expertise, and we just submitted 8 new projects for this year's funding. So that will bring us to 30. Altogether, we've provided more than $6 million of public sector support and a total of more than $12 million in applied research activity in Arizona, just at the WareTech Center. These applied research projects have resulted in products that range from a significant exit for one product to several products reaching the market and creating revenue for the startup companies or even mature companies. In addition, ASU created the Perform Science and Technology Center, and the U of A has announced CAMI, which is going to be a fantastic opportunity for our state. And the Bioscience, the Phoenix Bioscience Core has expanded tremendously. So MedTech in Arizona, as was mentioned before, has experienced liftoff. So we're really excited about talking about this with our panelists. And today's panel, we have 3 great panelists that you've been introduced to. Our first panelist is Alex Tessmer from BD, and we're going to go through a series of questions with our panelists, and then we're going to break into a group discussion. Alex and the BD team have been intricate partners in our MedTech activities here in the community, and we really want to thank Alex for joining us today. So Alex, can you tell us briefly about what you do at BD?
Sure, Wes, and thank you for hosting this panel and for inviting me. Great to meet everyone online here. So I am an associate director in ideation, which is basically our innovation department, where most of my job is focused on working with physicians to determine their problems and unmet needs. And then what we do is we take that unique unmet need that's been identified and thoroughly researched. I typically work with a project team to see if there's a suitable path forward to develop a safe and effective solution. We will also dive deep into the business opportunity, determine if the idea is a strategic fit within our company. And so overall, what's great is right in our backyard here in Tempe, Arizona, we own currently a couple buildings. We're leasing one large building, and we have a team of associates that are working every day to create minimally invasive medical solutions for clinicians to transform patient care. And to be specific, we focus on medical device innovation that help patients with cancer, peripheral vascular disease, and end-stage kidney disease.
That's awesome. And so BD is doing incredible innovation and research right here in the Valley. So why did BD set up this operation here, and what will make it impossible for you to leave?
Impossible for us to leave. I'll save that one for last. So first of all, BD consists of 8 business units, each which runs its own research and innovation team. One of those is us right here in the backyard, BD Peripheral Intervention, based in Tempe. And how we come about is actually through a series of mergers and acquisitions. So specifically, we actually started off in a garage in Tempe, Arizona, where a doctor got together with an engineer to work on with this material called Teflon to create vascular graft and patches. And so we were known as IMPRA back in the day. But in 1996, Bard bought us, and subsequently BD bought Bard in 2017. So we went from this company of doing grafts and patches to now a company consisting of thrombectomy devices, atherectomy devices, angioplasty balloons, drug-coated balloons, stents, covered stents, ports, and biopsy needles, and we're expanding in different adjacencies as we speak. So I believe, going to that last question, what would make us impossible for us to leave? Well, I think what would help is if we moved our corporate headquarters from Franklin Lakes, New Jersey to Arizona, but that's not going to be a small lift.
Well, we want you to stay, and so we want to do everything we can to help you. And Ayushi, that's pretty cool. We might see you as a company as large as BD someday. So that's pretty exciting. What do you think the Phoenix area needs to do to attract more med tech research and development?
Yeah, I think, really what we need to do here is make it stickier for our startup and small med tech companies to stay in Arizona. I believe that, naturally, if you can get these small startups and that stay here, that research and development would then continue to flow out of those companies as they grow. We heard earlier that, hey, for companies to be successful and grow, they have to have research and development, they have to have innovation. So Arizona needs to find ways to keep them from moving out of town and staying in our state. We need to figure out, in my opinion, how to build capital and infrastructure to retain these companies. One interesting initiative is supporting the Arizona Health and Innovation Trust Fund. This was established here in Arizona. It's an endowment model, which once fully funded will yield returns on an ongoing basis. So the great thing is this is established already under Arizona State Treasurer's Office, and I think it could potentially yield benefits to Arizona today and for generations to come, delivering both economic and health impact. But, ultimately, it's how do we build that capital and infrastructure together as an Arizona community?
What do you think the benefits of having a company like BD in the community and having a strong med tech presence? How does that benefit our community as a whole?
Yeah, I believe by growing the med tech sector in Arizona that this is going to increase the employee talent pool, increase our ecosystem and the overall economy. So, as you get that talent pool, one med device employee might go to another med device company and so forth. Well, you start building that talent within. Also, you bring those higher, salary wages here. You get more expertise, and I think that will overall stimulate our economy.
Great, Alex. Thank you so much for sharing your wisdom with us today. Now I want to switch to Ayushi. Ayushi Patel is our next panelist, and Ayushi relocated CenSys from Irvine, California to the Valley. And welcome, Ayushi. What got you into this field of med tech?
Yeah, well, thanks for having me today. And I should say I'm officially at 1 year and 2 months of my move from California to Arizona. So I can say that the summers are not as bad. So it should not be a hindrance in recruiting going forward. But so just as a brief history of CenSys, we're 3 founders, Trevor, Andy, and myself. We're all biomedical engineers. And we were doing clinical neuroscience research, saw this big need of just lack of quick access to brain data. And we saw it as a bit of technological problem, habituation problem. And as we thought through it more and more, interviewed a lot of doctors, we figured out that, hey, it is a problem that can be solved with time and effort. It just needs the right resources, education, and right clinical use cases. So we pursued down that path, but that was the original story. And then a couple of years ago, I had this bike accident where I actually suffered a concussion. And it came full circle because I was in urgent care and I just described to them what happened to me. And they said, oh, you have no issues. You're clear to go. And the rest of the week, I genuinely struggled to stay awake, or I couldn't ride the car. And it hit me that, hey, somebody who understands this space is this scared of what is about to happen, what happens to people who don't. And that's what motivates us as a team to continue making brain data more accessible. And we're hoping to do that first in Arizona and then grow from here on.
Well, and you moved your company from Irvine to Arizona. What attracted you to the Grand Canyon State?
Yeah, so I'll give a brief history, and I was making notes of this because I was like, I don't want to forget any key points. So what first brought us here was a strategic investment from Honor Health in our seed round. So this was Q3 2022, and they led our seed round And that was our first inlet into the Arizona ecosystem. And they guided us to all these resources, the Flinn Foundation, Arizona Commerce Authority. We were very fortunate to apply for the Arizona Innovation Challenge Award and get it in our first time. So that was another entry point into the local ecosystem and just meeting other existing companies and some incredible people who've been doing a lot of work in the medtech ecosystem. And then just building on top of that, we were also very fortunate to receive the VERTEC grant, which I'm sure we'll touch upon at some point. And it really, we really saw ourselves growing within this ecosystem along with the state. So what I mean by that is there's a huge spirit of collaboration. We work with hospitals, universities on multiple different grants. And we could envision ourselves that how do we set up different pilots but that are funded by government grants or are industry sponsored by our investments? And how do we set up manufacturing in the future? How do we launch our early go-to-market strategy, test it, and then go nationwide? So just having that clear vision helped a lot. And also it helps that there's tons of sports culture in the state of Arizona. Some of the best sports performance centers are in Arizona. So just there were just so many factors that the vibe was very strong and we just could not deny it. And we love the state. So I moved here officially, love being here. I think it would be hard to move back, but that's why we're here.
We want you to stay. And trust me, everybody who's listening, we want Ayushi to stay. So what's the challenge to scaling up your business here in Arizona? What do you think as you look to the future?
Yeah, so we've had a lot of success going from 0 to 1 and 1 to 10. And then as we go from 10 to 50, which is getting through FDA, setting up manufacturing, setting up the next set of larger pilots and building up to a Series A company. The next challenges we see are how do we set up all operations as locally as possible? So by that, I mean, we have a hardware product as well. So setting up all those manufacturing practices, quality testing practices, IEC testing practices. There's just all these little details that there's some things the state just doesn't have yet. So then our challenge is, okay, do we work with somebody who is adjacent to the state? Can we find those resources that are still available? And I know we've talked about that in our meetings, that we're looking for specific kinds of IEC testing sites. So that's one. But the other challenge is that we've been able to successfully leverage some of the incredible non-dilutive opportunities that the state of Arizona has. So how do we ramp that up into actually tapping into more federal awards with additional institutes, bring those federal awards in and grow the clinical operations in the state? So just finding out new collaborators on top of our existing collaborators and scaling from that. So I think that's our next challenge, going from 10 to 50, if you will.
And I've enjoyed working with you at the WearTech Center. You're a WearTech project. Tell us how the WearTech Center has helped you.
Yeah, so I love working with you, Kathleen, and the rest of the team. I would say the biggest strengths of the WearTech grant is the concept that you must have matching awards. So it incentivizes the companies to go seek out the funds, private funds, and then match it with the public dollars. So it's not just the public investment itself. So there's some sense of accountability from the get-go that you are going to commercialize that project. So I think that's it's a much better concept in terms of grants. And then what I liked when we applied for the grant, there was a heavy focus on commercialization. So you guys did not want a technology that is going to be in R&D phase for 5 to 6 years. You wanted something that has a 2-year turnaround time. So that forces the companies to think about how do you do different pilots? How do you get out there, get the early feedback? So on the technical side, that has been great. In terms of like more organizational things, the flexibility of the award also is incredible because we did not have the NSF SBIR when we first applied for the WearTech project. So now that we have both of those awards, having the flexibility to work with your team to adjust the budgets and some of the milestones, and just having the flexibilities puts us at ease of mind as we have multiple grant awards and we go through that process. So yeah, I highly recommend. I've recommended some of the other founders that are out of state to come apply to this grant in Arizona and move here. So we'll keep doing that advocacy more and more.
Great, thank you so much. And our third panelist is Mark Van Dyke from the University of Arizona. Mark is the Associate Dean and is with us today. So Mark, tell us, what do you think is the growth opportunity for medtech in the community?
Yeah, thanks, Wes. Great to be here with everybody. I sit over top of a research enterprise that spans across engineering, and I think there's a lot of opportunity to couple more of what we do more broadly across engineering. We tend to think about medtech as in the domain of biomedical engineering, which, as when you introduced me, that's my home department. But I've learned in the position that I'm in that there's a lot of engineering and science, and just broadly across STEM fields that can be brought into the healthcare or medtech space. We have really interesting work going on in semiconductor manufacturing, as a lot of people know. There's a lot of great opportunities there, AI, software engineering, and even some of our mechanics people. We tend to work more in areas of, national security, national defense, aerospace kinds of stuff. But there's a lot of tough challenges in healthcare in terms of things like fluid mechanics, et cetera. So I think there's a great opportunity for us to couple more broadly across engineering and science in the healthcare space.
There was some questions earlier about, the tech transfer and how that's all working. And I know that you've got some ideas on that, but I hate to put you on the spot.
Some strong opinions. No, I knew there was going to be questions about this.
So can you tell us a little bit about that, what you see as the future for tech transfer?
Yeah, I would say we're very, very good at the transactional pieces of technology transfer. The Tech Launch Arizona here at the University of Arizona, or TLA, they do a fantastic job, best practices up and down the whole operation. But tech transfer out of a university has a lot of social and behavioral science aspects to it as well, which kind of goes underappreciated. In my own opinion, as to why we're seeing this decrease really is twofold. It's sort of interesting because we're seeing record research expenditures at the university. Last year we hit $955 million in the total research enterprise at the University of Arizona. And I can tell you in engineering, we will almost have doubled in research expenditures in the time that I've been here. So we've got this interesting period now, the last 4 or 5 years, where research is increasing. Some of the numbers that we saw in the report was that NIH funding is increasing, but tech transfer is decreasing. Why is that? One, I think, and it's really kind of inside baseball stuff. You wouldn't, people who are on the outside, not in the research enterprise at a university, wouldn't notice this, but one, a lot more regulation. And I don't think that that's a big issue, but things that are new and things that take time and sort of knock faculty off their focus is a challenge. And there's been a lot more regulations, especially with regard to conflict of interest in the last couple of years. But I think the big thing, and we're really digging into this at the U of A, we've got a couple of studies ongoing. We're actually going to work collaboratively with ASU and NAU on this as well, is how do we couple the research enterprise to the technology transfer enterprise? And we were looking at this specifically in engineering, and people might be surprised to learn that the technology transfer enterprise isn't coupled to the research enterprise in ways that you would think. It's not coupled in ways that's driven by the Bayh-Dole Act, for example. We've had 44 years of the Bayh-Dole Act, and things have gotten a little bit perturbed from the ideal virtuous cycle that the Bayh-Dole Act is intended to foster. So I think a combination of a couple of things have led to those outcomes.
So tell us, in the future is pretty bright, even with, as we overcome these challenges. Tammy is coming to Phoenix. Tell us about that. And I know you're excited about Tammy coming.
So the Center for Advanced Molecular and Immunological Therapies, or CAMI, CAMI. So it'll be a state-of-the-art research building. It'll be located on the Bioscience core campus. It will house state-of-the-art facilities and will be a huge attraction for new faculty coming in. There's also plans to build a bit of an incubator in that space as well. But I think importantly, what it really does is it allows us to have a place where you can develop a culture or a mindset, right? It's a little challenging on a campus as large and diverse as we are here in Tucson to really kind of like onboard people and to target certain types of individuals that you'd like to hire. We want to hire entrepreneurial scientists and clinicians and engineers, right? And to be in that environment, to have those facilities, and to be able to recruit the types of folks who can operate within the medtech ecosystem, I think is going to be a huge advantage.
It's going to be really, really exciting, and we can't wait till it gets going. So now let's switch a little bit. There were some questions about, can you make enough employees? Are you guys doing workforce well enough? I think that all of that is happening, but I want to talk to everybody, because one of the things in the report that talked about how do we increase our stature, how do we actually get those high value growth opportunities, and how do we scale these businesses up? It pointed to networking and things like that, which seem pretty simple, but they're hard. Let's talk as a group about collaboration and how you see that happening. And I'm going to start with Mark. What do you see as the value of collaboration, and how do we need to do more of it? And then we'll go back through the group.
Yeah, it's absolutely essential. We as universities, I think, haven't done a good job in collaborating with the outside world. Universities are unique places. The people that live and work inside universities are very unique. I spent 10 years in industry, so I've seen both sides of it. We don't think first and foremost about things like economic development. We think about, things that academics care about, publishing papers and graduating students getting the next grant, right? And all of that can happen within the silo of a university. But we've been making a concerted effort to work more with our economic development partners, the ACA, GPEC, even local and regional with the city of Tucson and Pima County. But you have to have that intentionality. You have to embrace use and user-inspired research. As an academic, you say you want to solve problems, but at the end of the day, what is it that you value? Well, we're motivated to value papers. We're motivated to value the next grant. But how do we value job creation or new products that might come from our research? We need to do a better job of incentivizing faculty to value those things too.
Ayushi, what do you think about collaboration, and is is Phoenix a good place to collaborate in your experience here in the last 14 months?
Yeah, and I think it's a fantastic place to collaborate. What I feel can be done. So let me give some context. So Orange County had been great for cardiovascular, diabetes, and certain realms, but it wasn't as good for us in terms of neuroscience. Then as when you look at Arizona, there's just incredible amount of neuroscience, neurology research that happens here. So for us, the resources we can tap into are exponentially more. So with that preface, what we've found through the VeriTech Award is the collaboration between health system, university, and industry can be very powerful when set up correctly. So what does that mean? That is less bureaucracy. Can we get through a lot of red tape? Because last thing any industry or co-founder wants is be stuck in paperwork for months and months. That can be very frustrating because we're burning money and we're not getting where we need to be. So if there are strategic things that can be done that motivate people to move faster at the pace the industry wants, then there's nothing more than for us to spend some industry sponsored study dollars to be able to kick off these collaborations. And as I had mentioned, one thing we're looking to do is how can we now create a pipeline of NIH and DoD awards to improve the clinical pilot pipeline for CenSys and do a lot of work with different universities and hospital systems in the area and just grow as a whole. But I think we've been very fortunate to have partners working with us to actively cut through the red tape and get us what we need. And that just incentivizes us to do more and more. So I think that would be a big one.
Alex, what you worked with a lot of collaboration and especially with health systems. How do you think that benefits the whole community and medtech and especially?
Yeah, I think it's imperative because look, we are, as industry, for instance, I mean, we rely on each other, right? So we're working with healthcare facilities. They're working with us. We're working with universities because we're trying to draw on all these experience because hey, we might need this transformative technology from a U of A, an ASU, a Grand Canyon University, Northern Arizona University. What are they coming up with that we can use to ultimately help patients? And for us, specifically, we're developing medical device technology, typically that physicians are using. And so we need a way to collaborate with healthcare to be able to go in and observe cases, be in that in-use environment and figure out, the challenge always comes down to the, a lot of times the intellectual property and contractual agreement. And, if we can get through that red tape and figure out how to collaborate and put that patient first, I think that's where, when we can figure out, okay, how are we going to innovate and help these people and immerse ourselves in this environment together in these problems, it can be very beneficial. So again, I think collaboration is essential.
It's an old IP bugaboo, always in the way. One of the questions in the chat for the earlier group was one that didn't get addressed, and that's AI and how are we integrating AI into all the things we're doing, and everybody is doing it. Ayushi, what do you think about that?
So we're a company that's taking it one step at a time. I think AI in clinical use from what our experience is, has to tie back to the value add for the physicians. And it has to, in some ways, not be a black box, because why would a clinician trust and make a decision if they don't fully understand or trust the data coming out of that system? So the stepwise approach we're hoping to take is let's first embed our product in the system, have the doctors earn their trust and credibility. And then once they're comfortable with that unit, build the algorithms on top of it, and then take a stepwise approach where they feel comfortable using any assessment that comes out of it. AI can be easy to deploy, but hard to adopt, as we've seen. So I think for us, it's important to quality control it because these physicians make life or death decisions. So that's how we're looking at it, at least at CenSys.
Well, I just noticed we are right at time, so we're going to have to stop our conversation for now so that Tammy can close up today. But we really appreciate you all joining us and appreciate all the people who stayed online to hear this panel discussion. So thank you very much, and I'll turn it back over to Tammy for closing remarks. But thank you so much.
Thanks, Wes.
Thank you.
Thank you.
Yes, thank you. And thanks to the fantastic panel. That was terrific. I am incredibly optimistic that we're going to see even more growth in this sector of Arizona's biosciences. So before you take off, please, there is a link in the chat box that is to a survey related to today's event. And we would be really appreciative if you would take a minute to complete it. And then if you have any other feedback, after you take a look at the brochure or reflect on today's presentations, we would really encourage you to send that to us at the Flinn Foundation via the email address that Brian's going to put in the chat box right now. And the bioscience work that's being done in our state really helps us improve lives for Arizonans now and in the future. And we thank all of you for that role. So thank you to the presenters and to everyone who was in attendance today. Look for an email that will be coming to you from the Flinn Foundation. It will have links to the progress brochure. It will have a video of today's program and many other resources. Thanks again, and have a great afternoon.